Well, hey everybody, this is Robert and welcome to this Outbreak News TV educational video. And today I'm going to be talking about some of the more interesting parasites, the trematodes, or the flukes as some may call them. Now, I'm going to go over some of the general characteristics that apply to most of them. They're unsegmented helminths, which are flat and broad, resembling the leaf of a tree. That's the majority of them we're going to be talking about today, with the exception of the schistosomes, which will be the last group of trematodes I'll be talking about. Most of them have two suckers, one at the mouth and one on the body, an oral and a ventral sucker, which is used for movement and host attachment. With the exception of the schistosomes, most are hermaphroditic. And for all of them, the snail, specific snails for each parasite, but the snail is the intermediate host for the trematodes or the flukes. General life cycle, with the exception of the schistosomes, the eggs leave the definitive host, which is the human, in feces or in sputum in the case of Paragonimus. The eggs develop in the water. The mericidium, or the ciliated larva, leaves the egg, and it finds the snail and penetrates it. This is the first intermediate host. There it develops sporocyst, ridii, cercaria. The cercaria leaves the snail and encysts as a metacercaria, and this is the infective stage. The metacercaria can be found on a water plant, in fish, in crab or crayfish, all depending on the species of trematode we're talking about. Now, the metacercaria, like I said, is the infective stage. This is consumed by humans, where in the body it will exist in the intestine, and you'll get the adult parasites in the liver, intestine, bile ducts, or even lungs, depending on the species. Now, the first one I want to talk about is Fasciola hepatica, better known as the sheep liver fluke. It's related to another trematode called Fasciola gigantica. And Fasciola hepatica are found in areas where there's sheep and cattle being raised. And typically people become infected by eating raw watercress or other water plants that are contaminated with the immature parasite larva. The symptoms and pathology. The immature larval flukes migrate through the intestinal wall, the abdominal cavity, and the liver tissue into the bile ducts, where they develop into mature adult flukes, which produce eggs. Some of the symptoms and pathology include, in the acute stage, nausea, vomiting, abdominal pain, and tenderness. And in the chronic stage, you may see inflammation and blockage of the bile ducts, inflammation of the liver, gallbladder, and pancreas. And here we have an adult Fasciola hepatica. Diagnosis. This could be made by finding the eggs in the stool or in other material like duodenal or biliary drainage. Infected people don't start passing eggs until they have been infected for several months. People don't pass eggs during the acute phase of the infection. Therefore, early on, the infection has to be diagnosed in other ways than by examining the stool for parasites. The eggs of Fasciola hepatica are broadly ellipsoidal, operculated, and here you can see the operculum. It's like a little lid. And they measure about 130 to 150 micron long and 60 to 90 microns wide. The eggs are unembryonated when passed in the feces. Diagnostically, they're very difficult to distinguish from the related Fasciolopsis species. So a travel history is very useful. Now, Fasciolopsis buski, or the giant intestinal fluke, this is the largest fluke found in humans. and it's found in South and Southeastern Asia. It's also can be found in mammalian hosts from humans to pigs. So how does one become infected? Well, people become infected when they ingest the metasecarial cyst stage on encysted water plants. Some examples would be water caltrops, which we have a picture here that you can take a look at. It's this funny looking bowl-shaped nut sort of plant that people will eat. They'll bite the skin off to get to the meat of it. And while they're doing that, if the metasecaria stage of the parasite is on it, they will end up ingesting it and get infected. Water chestnuts and water bamboo are some other types of water plants. Humans become infected is by peeling of the fresh water plant with their teeth and the accidental ingestion of the contaminating metasecaria. Symptoms and pathology. An infection with only a few trematodes may be asymptomatic or very few symptoms. Cases can occur where there may be hundreds of these parasites present, causing problems with digestion or even intestinal obstruction. Some other symptoms include eosinophilia, edema of the tissues of the face. And here is an adult Fasciolopsis buski. Diagnosis, microscopically identifying the eggs, or more rarely, finding the adult flukes in the stool or in vomitus is the basis of a specific diagnosis. The eggs of Fasciolopsis buski are broadly ellipsoidal, operculated, and measure about 130 to 150 microns long by 60 to 90 microns wide. What does that sound like? Very, very similar to Fasciola hepatica. The eggs of Fasciolopsis buski can be difficult to distinguish from Fasciola hepatica, although the abo-opercular end of the latter often has a roughened or irregular area. The next parasite is Clonorchis sinensis. This is also known as the Chinese or Oriental liver fluke. Liver flukes infect the liver, gallbladder, and the bile duct in humans. People can become infected by eating raw or undercooked fish, and the fish is the second intermediate host with this parasite. Remember, the first intermediate host is going to be a snail. The second one in this parasite is a fish. And this is found all across different parts of Asia. Symptoms and pathology, mostly asymptomatic. Untreated infection may persist for up to 30 years, basically the lifespan of the parasite. In infections that last a long time, an enlarged liver and malnutrition may occur. In areas where liver flukes are endemic and a person may have had multiple long-standing untreated liver fluke infections, the inflammation of the gallbladder and ducts caused by the parasite has been associated with liver and bile duct cancers, including cholangiocarcinoma. And here's a Clonorchis sinensis adult fluke right here. Diagnosis: the eggs of Clonorchis sinensis are very easy to distinguish. They're smaller than the other trematodes, ranging in size from 27 to 35 microns by 11 to 20 microns. The eggs are oval-shaped with a convex operculum that rests on visible shoulders. And you can see that right here where I have the pointer. Very, very broad shoulders on this parasite. At the opposite end, you have a large abo-opercular end, which you may see a small knob or hooklet at the end of it. And it's often visible. The mericidium is visible inside the egg frequently. So often you can see the parasite within the egg. Diagnose, as you can see that in this picture too. Here's the broad shoulders, the operculum, the aboopercular knob, and the meriscedium inside it. Diagnosis is based on microscopic identification of eggs in stool specimens or duodenal drainage. The eggs of Clonorchis are practically indistinguishable from those of Apisthochus. Now, this is another parasite. Looks a lot like it, very similar in symptomology, but I'm not going to be going over that in this lesson. The adult fluke can also be recovered at surgery. Next is Paragonimus westermani, or the lung fluke. Now, there's a bunch of Paragonimus different species that are distributed throughout the Americas, Africa, and Southeast Asia. The main one I want to talk about here is Paragonimus westermani, which is found in Southeast Asia and Japan. Now, there's a parasite Paragonimus species that is found in North America here in the United States, and we see mini outbreaks sporadically around this country when people eat undercooked or raw crabs or crayfish. And that's called Paragonimus kellicati. And as I mentioned, right, the snail is the first intermediate host. With this parasite, raw crabs or crayfish are the second intermediate host. Specialty dishes in which shellfish are consumed raw or prepared only in vinegar, brine, or wine without cooking play a key role in the transmission of Paragonimus. Raw crabs or crayfish are also used in traditional medicine, different practices in Korea, Japan, and in some parts of Africa. Pathology. Infections with Paragonimus species can result in an acute syndrome with cough, abdominal pain, discomfort, and a low-grade fever. People with light infections may be asymptomatic. Symptoms of long-term infection may mimic bronchitis or tuberculosis, with coughing up of blood-tinged sputum. Extrapulmonary locations of the adult worms result in more severe manifestations, especially if they end up in the brain. And here is an adult Paragonimus westermani. Diagnosis. You could see a rusty sputum which contains flecks of blood and eggs, and charcoal-laden crystals, which are essentially these long, thin, diamond-shaped crystals that are the breakdown products of eosinophils. Now, Paragonimus eggs range from about 80 to 120 microns long by 45 to 70 microns wide. They are yellow-brown, ovoid or elongate, with a thick shell, and you can see the thick shell here. It's pretty evident. And often asymmetrical with one end slightly flattened. At the large end, down here, the operculum is clearly visible, very, very large. At the opposite of the aboopercular area, we have more of a thickened shell down here. The eggs, when they are passed, are unembryonated, and they can be passed in either the feces or in the sputum. Morphologically, they have a resemblance to Diphyllobothrium latum, the fish tapeworm. And diagnosis, besides identifying the eggs, can be done with different serological methods. And let me go ahead and close out with the blood flukes, right? The schistosomes, also known as bilharzia, after the gentleman who discovered them. In terms of impact, schistosomiasis is second only to malaria as the most devastating parasitic disease. They live in the blood vessels of humans. That's the definitive host. In the veins around the intestinal tract, you'll find Schistosoma mansoni or Schistosoma japonicum. And then there's the bladder fluke. Schistosoma hematobium can be found in the veins around the bladder. Now, unlike the other trematodes that we've talked about, there is a male and a female. They are not hermaphroditic. The male and female coexist in pairs during the lifespan. And unlike the other trematodes, they are not flat and leaf-like. They are cylindrical. Now, the geography for the different parasites is widespread. With Schistosoma mansoni, it's found in a few parts of South America and the Caribbean, parts of Africa and the Middle East. Schistosoma hematomium is found in Africa and the Middle East. And Schistosoma japonicum is found only in the Far East. It's not found in the United States. And more than 200 million people are infected worldwide at any one time. And here I listed, I don't know if you can read it, but it tells you that some of the areas where it's likely the parasite is found. So in Africa, contact with any fresh water in southern or sub-Saharan Africa. So places like the Nile River Valley is a good place. South America, it's still found in Brazil and Venezuela. It's found in some of the Caribbean islands, though the risk in the Caribbean is considered quite low. In the Middle East, schistosomiasis is found in Iran, Iraq, Saudi Arabia, and Yemen. And of course, Schistosoma japonicum is found in southern China, other parts of Southeast Asia, like the Philippines and Laos. And there's been a recent identification of ongoing transmission in the island of Corsica. I think that's outside of Italy. There was a recent transmission reported several years ago. And here's the life cycle, quite complicated, right? So the individual will either defecate out the eggs, or in the case of Schistosoma hematomium, it could be defecated out, or it can come out in the urine. The eggs hatch and then release the merocydia. The merocydia is this little ciliated thing. It'll swim around, finds the appropriate snail. Each parasite has a very specific snail that they have as their first intermediate host. Then it goes through successive generations within the snail. Then the Cercaria, in the case of these Cercaria, with the schistosomes, they have like this forked tail on it, and they come out and they start swimming around looking for a host. There's a person in the water, wading in the water, doing whatever in the water. It penetrates the skin. When it penetrates the skin, it will lose its tail, and it gets into the circulation, where it finds its way into the portal blood of the liver and matures into adults. And at that point, the paired adults, these two cylindrical worms, male and female, will migrate to the vesicles, the venules of the bowel or rectum area in the case of Schistosoma mansoni or Schistosoma japonicum, or the vessels of the bladder in the case of Schistosoma hematomium. And this kind of goes over what I just talked about. Eggs are eliminated with feces or urine. They hatch, release the merocydia. It swims and penetrates a specific snail, intermediate host. The snails include a couple generations of sporocyst and the production of Cercaria. Upon release of the snail, the infective Cercaria swim, penetrate the skin of a human host, and shed their forked tail, becoming Schistosomiae. The Schistosomiae migrate through several tissues and stages to their residence in the blood vessels. Symptoms and pathology for schistosomiasis. The pathology for Schistosoma mansoni and Schistosoma japonicum can include, depending on the species, Katayama fever, granulomas, Simmer's pipestem periportal fibrosis, portal hypertension, and sometimes you can get these egg granulomas in the brain or spinal cord. In the case of Schistosoma hematomium, we're talking about hematuria, scarring, calcification. Schistosoma hematomium has been linked to bladder cancer. and occasionally ectopic egg granulomas in the brain or the spinal cord. So it can be a very, very serious disease. Diagnosis. These are some of the easier parasites to identify. They're very large and they have some very characteristic features to them. Schistosoma-Mansoni, microscopic identification of eggs and stool is the most practical method for diagnosis. And there's also, of course, antibody detection and other methods. The eggs are large, about 114 to 180 microns long by 45 to 70 microns wide, and have the very characteristic lateral spine near the posterior end of the egg. Can't miss it. Schistosoma hematobium, also quite large, about the same size as Schistosoma mansoni, but this differs in that it has a very obvious terminal spine as opposed to the lateral spine with Schistosoma mansoni. The other big difference is not only is it found in the feces, it can be found in spun urine. And then there's Schistosoma japonicum. They're large and more rounded than the other species. They're about 70 to 100 microns long by 55 to 64 microns wide. And they may have, they're going to have, but whether you can see it or not, that's another question, smaller, less conspicuous little spine or knob on one end of it. Clearly not as prominent as the spines on Mansoni and Hematobium. And that's it. That's the little lesson for Trematodes today. I left out a few, but it covers many of the most important ones. And we can see that a lot of these are foodborne, with the exception of schistosoma, the schistosomiasis. So, yeah. Well, I hope you enjoyed it and hope you get something out of it. If you're not familiar with parasites, I hope you found it interesting. If you are, hopefully I didn't leave anything out for you. And please go ahead and share it with your friends. Like the video, comment below, let me know what you think. And subscribe to the channel. Help us grow at Outbreak News TV. And I'll see you next time. Have a great night.